with Dr. Shizuka Ko from University of Osaka. She's going to present on Corneal Biomechanics.
Actually, this is too high. Okay. Hi. Okay. Can I start my presentation? Better to hear? Okay. Thank you. Good morning, everybody. It is my great pleasure to give a talk here. I'd like to thank a committee member of AIOC. Keratoconus is a progressive corneal ectasia with onset typically in the second decade of life. It presents bilaterally, although often asymmetrically. It is characterized by stiffening, distortion, and apical thinning of the cornea, leading to visual deterioration due to irregular corneal astigmatism. Among the corneal disorders, it is not a rare disease, but as mentioned frequently, it is frequent rare disease. Thank you. Okay. So I'd like to start with a very famous phrase by Professor Cynthia Roberts. She actually wrote this phrase in the editorial in the Journal of Refractive Surgery more than 20 years ago. The cornea exhibits both viscous and elastic biomechanical behavior. Excuse me? Okay. So what is the biomechanics? So biomechanics is the study of the mechanics and application of the structure and motion of human organisms. When we think about the biomechanics of cornea, biomechanics of cornea can affect its functional responses and greatly impact vision. The pathophysiology of keratoconus includes genetic disorder, biochemical disorder, biomechanical disorder, and environmental disorders as well. It is recently reported that the corneal biomechanical changes may occur before the curvature changes in the development of keratoconus and ectasia. So it is very important to measure the corneal biomechanical properties. Currently, there are two commercially available devices for measurement of corneal biomechanics: ocular response analyzer and Corvis ST. Actually, in our university hospital, we are using only Corvis ST, so my presentation is based on the data from Corvis ST. So Corvis ST is a non-contact tonometer that allows investigation of the dynamic reaction of the corneal to an air impulse. Shown here is movies from the normal eye and keratoconic eye. You can see the remarkable differences in the two movies. Actually, Corvis ST actually provides so many parameters, so I'd like to focus on the very important ones. So this is a display from Vinguera screening report. So we can just look at the bottom right of the this display. So this blue box. So right end of the blue box, you can see the color bar. This is Corvis Biomechanical Index (CBI). This is based on the corneal thickness profile and deformation parameters. Again, Corvis Biomechanical Index (CBI) is calculated on the corneal thickness profile and deformation parameters. It is reported that it is useful to detect clinical keratoconus and subclinical keratoconus as well. It ranges between 0 and 1. Recently, tomographic biomechanical assessment is also introduced. The point is actually it combines the biomechanical assessment and tomographic assessment. So actually both devices are Oculus. So Corvis ST for biomechanical assessment and Pentacam for the tomographic assessment. The combined index is called as Tomographic Biomechanical Index (TBI). It is called that it can enhance the ectasia detection. Actually, this is a display from the Corvis ST. You can see the CBI and BAL-D and TBI. First keratoconus, this is a fellow eye of very asymmetric ectasia. This is defined as the fellow eyes of very asymmetric keratoconus, which does not present with clinical or topographic signs, while one eye manifests with clinical keratoconus. According to the global consensus on ectatic disease, keratoconus is often asymmetrical between two eyes, but it says true unilateral keratoconus does not exist. However, unilateral ectasia may occur. So we cannot say unilateral keratoconus, but we may say unilateral ectasia. This is a first study result of the first study, which says TBI can detect more efficiently compared with BAL-D or CBI. Actually, if you see the pink box in the TBI area, you can see the separate TBI can separate the fellow eye of VAE. Let me show you the clinical cases from our hospital. This is a case of very asymmetric ectasia. Definitely, the left eye is clinical keratoconus, but the right eye has a normal topography based on the placebo topography. And also, his right eye has a good visual acuity. When we look at the biomechanical or tomographic biomechanical assessment, you can see that BAL-D from Pentacam and CBI from Corvis are okay, but the TBI, tomographic biomechanical assessment, says this is an abnormal value. So subclinical ectasia detected only by TBI. This is another case of very asymmetric ectasia. The right eye is a clinical keratoconus, but the left eye, fellow eye, has normal topography. When we look at the biomechanical assessment and or tomographic biomechanical assessment, actually his VAD value, CBI, and TBI are all completely normal. So we may say that this case may be true unilateral ectasia, not true Fru's case. Actually, many studies actually from different countries reported that TBI is useful in detecting subclinical ectasia. Of course, there is a report from India. So in our study for Japanese population, actually 60% of the VAE with normal topography showed the abnormal values at least one parameter, but the rest of 40% of eyes showed completely normal values in any corneal parameters. So unilateral ectasia is possible. And TBI allows separation of true unilateral ectasia from true Fru's cases. It is important to screening for ectasia risks like familial background, eye rubbing, HP, or allergy. So to know the high susceptibility is very important. Lastly, I'd like to mention about the further investigation of fellow eye of very asymmetric ectasia. As I mentioned, through very asymmetric ectasia with normal topography, it is defined as frumiferous keratoconus, usually have the fellow eye has no abnormal sign at slit lamp, no abnormal sign at topography, actually on anterior corneal surface. But we don't know whether they have a abnormal value in tomography or beyond the measurement. So if we classify these eyes based on the tomography results, normal or abnormal, we can classify as VAE with normal topography and tomography, or VAE with normal topography. Corvis ST recently introduced the stress strain index. Actually, this is a new parameter. It can estimate the overall stress strain behavior of corneal tissue. Lower values indicate lower material stiffness. So it correlates only with age. Recently, we report the 3-year follow-up of biomechanical changes in very asymmetric ectasia with normal topography. Actually, in this study, we classified these eyes into two types based on the tomography. So VAE with normal topography and tomography, or VAE with normal topography. What we found is significant decrease in SSI, SSI in very asymmetric ectasia with normal topography, but there was no biomechanical changes in VAE with normal topography and tomography. It suggests that possible progressive corneal softening even in a subclinical status such as a very asymmetric ectasia with normal topography such as FFKC.